When you consider the impact that COVID-19 has had, not just on the nation, but in our healthcare industry, you certainly will see there has been an impact in the chiropractic community. Has that impact of COVID made it more or less difficult for the doctor to purchase an existing chiropractic clinic? Well, first of all, when you're working with financing, you have to understand that there's really today in 2021, there's going to be two different analyses that take place. One is going to be from the bank's perspective, and the other is going to be from the financing package perspective. So, for a minute, let's focus on the bank's perspective. When I'm preparing a financing package with a buyer to help them buy out a clinic, I am now being asked to address the issue of COVID-19 and the clinic. In other words, the bankers are putting the clinic and the seller's operation under a microscope to see how has COVID-19 impacted their patient volume, their revenue, their expenses, their marketing, just overall, what has the impact been? And the second part of that question is, and how has the selling doctor's business recovered from COVID-19? So when I'm putting that package together, we are very carefully looking at 2020 numbers, revenue, expenses, patient volume, new patients, patient visits, all those primary practice statistics, and we're tracking them very carefully so that we can explain to the lender exactly how this clinic has performed through the early stages of COVID-19 in the early part of 2020 into the summer of 2020, and then through the fall and into the early part of 2021. So it is a very careful presentation that we're putting together when we're addressing the issue of COVID. The underwriters most definitely are aware that COVID-19 has had an impact, not just on chiropractic, but on businesses overall. And so they are certainly going to be looking for information in our financing package talking about that. And I can also tell you that just recently, some of the lenders are creating special forms that the buying doctor, the selling doctor have to complete talking about COVID-19. And how you complete those forms is incredibly important. You have to know what you're doing when you're answering some of those questions. So, most definitely, COVID-19 has increased the scrutiny that a buying doctor's financing package is going to go through during the underwriting process. The second side of the coin is, okay, I'm talking about a financing package. And basically, what I mean by that is there are three legs to the financing package chair when we put this together and put it in front of a bank. The first leg talks all about the buyer. And so certainly the buyer is going to go under scrutiny with their tax returns, personal financial statement, resume, all kinds of information. Certainly student loan information is going to come into play that as well. But secondarily is going to be the marriage of the buyer and their financial needs based on the buyer's financial tax returns and the seller's clinic performance. Now, this is where the COVID-19 impact marries the buyer's future ability to not only cash flow the clinic, but also grow the practice through the remainder of the COVID-19 impact. So it's very important that when that buyer, when we put that financing package together, it has to have all the detail in it that we've always had. Plus, we now need to weave into that financing package the story of COVID-19 and this clinic. And we need to address that in such a way that the underwriter feels comfortable that this buying doctor has the skill set and the knowledge and the capability to help grow this clinic through the balance of COVID-19. So yes, it's a little bit more challenging, but It's always been challenging, and the banks are most definitely willing to fund if you give them the data they need and you present it to them in such a way that they feel comfortable putting their money on the line for this acquisition. So the good news is we're moving through the backside of this, hopefully. And yes, although it has had an impact on financing, we are still able to get funding, certainly through the various lenders we work with, if we give them a very well prepared practice appraisal so the banker knows how to do arrive at this purchase price. What is this based on? If we give them a very well prepared financing package addressing not just all the normal three legs of the financing chairs, so to speak, but also layer into that information about COVID 19 and the historical information about this practice. So, although it's a little bit more challenging, it most definitely can be done and is being done. So I'm more than happy to answer any questions you may have, but that is one of the questions that I am fielding more and more frequently here over the last 30 or 45 days. And I am certainly involved with the lenders, talking with them about their perspectives and keeping them at the table, understanding the recovery in the chiropractic community. And I'm very happy to say that most of our chiropractors are doing well and have pulled up out of the COVID 19 decline and are well on their way to recovery, if not already fully recovered.